Around the world, hundreds of thousands of people with mental health conditions are shackled, chained or confined in small spaces, sometimes for years at a time. This is Made. He's been locked in this room for 2 years. Shackling is a global problem. Human Rights Watch has documented the practice across 60 countries. Shackling is driven by stigma and inadequate mental health services.
Ose kama bama heka kivizu na videma wale safi joko je.
Tuto shumaro chagara godo ti wale semu. Mbati fiona no mandumi.
والله ما قلك حني ودي قصب بنا ما أقول أبحي لكن توافق غير هذا.
أفرتهم دولات بيجوا حرمة. بركايته وروريق يجي إنت ملا تشوف يو والله بعد كده بات بدن بيجوا هيسي.
I am in Bali, in Badung, one of the most prosperous districts, not only on the island but across the country, and even here I have found people with mental health conditions who are chained. Murat's about 40 years old and he has been living in this room for the last 10 years, chained by his family because they don't know what else to do. In some countries, people with mental health conditions are sent to faith healers where they could end up chained for years. That was the case in Ghana. When Human Rights Watch first encountered Felix in 2017, he was chained to this tree for 5 years at one of the many faith healing centers in the country. Later that year, the Ghanaian government promised to crack down on the practice of shackling.
If anybody puts a patient in chains, you, the healer, you, the parent, you'll be prosecuted in court.
When Human Rights Watch revisited the prayer camp, the chains were gone. And now, Felix walks free and is receiving support.
This is where you stay?
This is where I stay.
How do you feel to not have a chain?
I feel great. Yeah, I feel good. I feel very good. I feel very, very good.
Things are starting to change in Indonesia as well. This is Sodikin. He has been working in a clothing factory as the main breadwinner for his family. When I first met him in 2014, his family had locked him in a shed near his house. He'd been there for over 8 years. In the years since, Indonesia has launched a community-based mental health program that sends workers door to door, both in small villages and big cities, in an attempt to end shackling and get people the resources they need.
Bahagia aja, bahagia bisa membantu orang tua, kedua orang tua.
Rumah Berdaya, which literally means empowerment house, is a first of its kind effort to destigmatize mental health by engaging with the community and being a safe space for people with mental health conditions, including those who were formerly in shackles. It's a place to socialize, earn a living. It's an initiative that's working.
Human Rights Watch is calling on all governments to ban shackling. People with mental health conditions need community-based services like the ones here in Indonesia. And we need to work to end the stigma. With the right kind of support, people with mental health conditions can live free from chains in the community like everybody else.
Minta tolong agar dibuka. Minta tolong agar dibuka.